Good morning. I'm Dr. Shilpa, working in Eledent Dental Clinic in Kondapur branch. So today we are discussing about halitosis. Halitosis is also called as bad breath. Usually a lot of people or patients complains about halitosis. The people who is having halitosis, they lose the confidence to talk much. They'll be having some anxiety as they know they are having halitosis. And in certain kind of people, they don't know that they are having halitosis. So the common thing in these two kinds of people is that they do regular flossing, they do brushing twice daily and use mouthwashes, everything, but sadly all of this wouldn't work out. So moving on to the causes of halitosis. What are the causes of halitosis? The first main cause is like food. So if you're having some foods like onion, garlic and such kind of food and all, will cause some foul kind of smell after having that. And then other causes like systemic disorders like acidity. In such cases also this halitosis can be seen. So in case of the systemic diseases, you have to visit a doctor and do the treatment according to that. And moving on to the oral cavity, see if you have more decayed tooth, or you have more cavities, or your teeth is more malaligned, and if one teeth is overlapping the other teeth, in such situations you can see this halitosis when the food is being stuck between the two teeth, in such cases also. And the other cases like tongue, if you observe your tongue more closely to the mirror, you can see that a small papillas, very small tiny papillas are there, where the food will, after having more food, this food used to stuck over there. After time being, it will get stuck and will be like, it will sink over there. In such kind of situations, we have to use tongue scrapers. So tongue scrapers are very useful for this, to remove all this dirt which is present in the tongue. And the other situations are like dry mouth. In case of dry mouth, where actually saliva is a very good barrier against this halitosis. If lack of saliva can also result in this bad breath. So moving on to the treatment. What are the treatments of halitosis? So first and foremost thing, you have to visit a dentist. If you feel you have a bad breath and all, you should visit a dentist, and then the dentist will rule out what is your problem and then do the treatment. So and the first and the foremost thing that the dentist will suggest you is scaling or cleaning. Cleaning means, it doesn't mean that you are not cleaning your teeth properly. You will be brushing your teeth twice daily, but there are certain areas where the brush might not reach properly. So in such kind of situations, the dentist use an ultrasound scaling, and then the scaler tip will go between your interdental surface of your teeth and then between the gums and all. So all the bacteria, plaque, everything will be removed. And in case if you have this gingival, like gum enlargement or gum diseases, all these cases also we'll go for first step is like scaling. So after this itself, almost majority of the problem will be solved. And then after scaling, any cavities is there, or cavities or decay, in such situations also, the dentist will suggest you about what particular treatment that you have to go on, and then do the treatment according to that. And if there is nothing related to oral cavity, then the dentist will suggest you to go to your doctor or general physician for something related to any systemic disease. So at least once in 6 months you have to visit a dentist.